Hey mate, I'm Luke, and what we're doing today is we're doing an adult pre-exercising and health screening. What it is basically, it helps me gain an understanding of where you're at as a fitness level, and basically how to go about getting you more fit and starting to point to develop a better lifestyle for you, basically. Okay. What we're going to do is we're going to go through this stage one here, and I'll start off by stating your name.
Dwayne, D-U-A-N-E.
Yep. And last name.
Goodwin, G-W-D-W-I-N.
And your date of birth.
11th of the 7th, 72.
Yep. Male, obviously. And the date today is the 8th. Alright, too easy. I just got a few questions for you here. Okay. Just to see whether you're a low, moderate or high risk client, and if you can start exercise straight away. Has your doctor ever told you that you have a heart condition or have suffered a stroke?
No.
Yep. And do you ever experience unexplained pains in your chest at rest or during physical activity / exercise?
No.
And do you ever feel faint or spells of dizziness during physical activity exercise that you have to lose balance?
No.
Yep. And have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
And if you have diabetes, type 1 or type 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
And do you have any diagnosed muscle, bone or joint problems that you have been told were made worse by participating in physical activity / exercise?
No.
Okay. And do you have any medical conditions that may make it dangerous for you to participate in physical activity / exercise?
No.
Okay. So you've answered no to all the 7 questions, and you have no other concerns about your health.
No.
You may proceed to undertake light, moderate intensity physical activity / exercise. So I believe that, to the best of my knowledge, all the information being supplied within the tool is correct. I just need you to sign there and date it. Before we go on to stage 2, do you have any short-term or long-term goals that you'd like to set yourself as a fitness goal?
A fitness goal.
So short-term?
Short term, I'd like to lose 2 kilos
Yep.
of extra weight, probably around the midsection.
Midsection, yeah. And do you have a long-term goal for yourselves in participating in fitness?
Yeah, I'd like to be able to run 10 kilometres without stopping.
Yep. Too easy. Okay, we'll go on to stage 2. This is to determine whether you're a low, moderate or high risk client during exercise.
Okay.
That was to see if you could participate. Yeah, if you could participate. Alright, so can I have your age please?
42.
42. Gender male. Family history of heart disease?
No.
No. None. And do you smoke cigarettes on a daily or weekly basis, or have you quit smoking in the last 6 months? Yes or no?
No.
Okay. And describe your current physical activity / exercise levels. Would you say frequency, session per week?
Right, how many sessions?
How frequent do you
2.
do per week? Yep.
1 to 2.
Yep. And how long do you usually train that for?
30 minutes.
30 minutes, yeah. And please state your height.
176 centimetres.
Yep. And your weight.
69 kilos.
Yep. And have you been told that you have high blood pressure?
No.
Okay. And have you been told that you have high cholesterol?
No.
And have you been told that you have high blood sugar?
No.
No. Okay. And it says here that you have 0 total risk factors. So you're a low risk low risk client during exercise. Okay, and this is like
Is that good?
that's good. So a high risk client would be someone with diseases like a cardiovascular disease or hypertension. There's someone that those are some serious diseases in those cases, but there's also things like obesity and anorexia, which are disorders that make them a high risk client as well.
Sure.
So yep. And firstly, to do exercise, do you have any injuries or illnesses that you suffer from?
At the moment,
Yeah. Do you have any injuries or
No.
illnesses? No. So no injury. Before we start going on to the next thing, do you have any lifestyle factors that you will stop you from partaking in a exercise program?
what do you mean?
So
Lifestyle.
maybe like a drinking disorder, or you're addicted to smoking or something like that? Any of those, or
No.
so basically anything that will just stop you from partaking in an exercise program that affects you and your lifestyle. So no?
No.
Alright, too easy. Right. So have you spent any time in hospital?
No.
Okay. Are you currently taking a prescribed medication or
No.
medications for medical conditions? No.
No.
Are you pregnant? No. Sorry. And do you have any muscle, bone, or joint pain or soreness that is made worse by particular types of activities?
Yes, I do have a osteoarthritis in my elbow.
Rolling.
Okay, now on to stage 3. I'm just going to ask you a few questions out of here that we measured your things before. What was your BMI again?
22.
And your waist girth in centimetres?
40 centimetres.
And what was when you totaled your resting?
96.
Yeah, that's it. Alright, so there's no risk factors there. No. And your risk stratification is that you have 0 risk factors, which means that you are a low risk client and you do not need medical clearance from the doctor to participate in exercise, and you can start straight away. Is there anything any questions you have or anything?
No.
I'd just like to tell you that a nutrition is also very good with a diet, with an exercise program, because nutrition can cause diseases that I explained to you before, but it's also a behavioural issue as well. It can affect how you feel, think and act. A bad diet also slows the muscle response and stuff like that. That makes you become less alert when you're training. So a good diet as well as a good exercise program, we should have you losing those 2 kilos in no time. Alright, thank you for your time.
Thank you.
I'll see you soon.